Hello, everyone. My name is Annika Thach, and I am a Senior 2 nursing student at Pacific Lutheran University. For my senior preceptorship, I was given the opportunity to travel to St. Francis Hospital in Federal Way and be mentored by such amazing nurses on their intensive care and progressive care units. For my senior capstone project, I decided to focus on the topic of nursing care of the post-cardiac arrest patient undergoing targeted temperature management, TTM. So just an overview of TTM, also known as therapeutic hypothermia, is a process in which the patient's core body temperature is lowered or cooled to a certain degree in order to optimize neurological function. Now, initially, what had sparked my interest in this specific topic was the fact that this procedure was so prevalently used on the units that I was working on. And in fact, I was able to care for two patients that were undergoing this treatment that I honestly found super fascinating, and I wanted to delve in deeper in the research and just learn more about the process as a whole. Now, when I was conducting my research, there are many things that surprised me and also reinforced what I saw in practice. For example, I would constantly see the nurses reviewing and going back to the procedures and protocols of this specific treatment and just making sure that they understood the systematic approach that encompassed this entire therapy, as well as just making sure they understood their role in maintaining and prioritizing patient safety. Some of the key takeaway points that I would like to highlight for the audience from my poster include the assessment, interventions, and education portion. In terms of assessment, I would really like to bring forth the importance of accurate and frequent nursing assessments. Oftentimes, during neurological function treatments, there's a lot that can be missed, and so constant assessment and very accurate documentation is crucial during this stage. Making sure to report any adverse side effects or complications to medical personnel are very important in ensuring that the patient is getting the necessary treatment they need at that time. In terms of interventions, for TTM protocol, there's very specific steps and stages that encompass it. And so knowing the different stages and what steps are appropriate for that certain phase is important to optimizing the treatment and ensuring patient safety. And lastly, the education. Oftentimes during this time, patients and their families are going through a great deal of stress and fear that something potentially could occur in the future. And so just giving them that reassurance and education that if they are to follow the medical advice and treatments in place for them, as well as starting to live a better, healthier lifestyle, that the chances of a second arrest is lowered significantly, and that they have the power to impact their future. As I come to a closing to this presentation, I would really like to thank my nursing professors, mentors, preceptors, and peers for all the support and guidance in my nursing school journey. And I would also like to thank my friends and family for all the love and support that they have given me throughout the years. Although my although my nursing journey is just getting started, I would really like to continue to keep learning, changing lives, and saving lives. Thank you again for watching.